My name is Matt Siba. My question is based on a study from some 2005 numbers of the Harris County Hospital District. This district published a report, I believe, in 2007, which stated that $128 million a year in 2005 was spent solely on health care for illegal immigrants. $97.3 million of that was spent just by the county itself, I believe through property taxes, to pay for those costs. I also have a cousin who works in the Harris County Hospital District of Ben Taub Hospital. And he says that one of the problems that they have is these families will come to the emergency room because one of the children has a fever. And by law, they're required to check out the child. Anybody that comes to the ER, they're required to check them out. While the family is there, they say, well, will you check out everyone else and make sure they're okay as well? And so my cousin's complaint is that there are so many resources that are spent on this. And what's going on in my mind is it costs money to pay the ER doctors and nurses to do these tests, to check out these illegal immigrants. It costs money for all of the equipment, everything else that goes into it. If it's not being paid for by the illegal immigrants, who is paying for that? Are we paying for that in our own medical care? Does our insurance, is it higher because we're paying for people who are not paying for themselves? Is it higher because they don't have insurance? There's a, is it balancing out in that those who don't pay are being covered by those who do? Thank you.
Dr. George, would you like to take that?
Yeah, that's exactly correct. The law in the United States says that anybody who has an acute illness that comes to the emergency room must be triaged and treated appropriately if they're in danger. It does not say that you have to do elective things, and it does not say that you have to check out your family either. But this costs the American citizens and residents in two ways. First of all, it costs you because the resources are consumed, and these resources are consumed in fairly large quantities, and they're fairly expensive. The second thing it does is it walks up the time, and it means that someone else who is sitting outside waiting is not in that particular gurney or bed, or however you want to describe it. In Canada, the waiting lines are so long that people are lying in gurneys in the hall. The emergency rooms are jammed full. Up there, they're jammed full here too. There's an interesting phenomenon that occurs when an illegal immigrant's about to have a baby. They kind of circle the parking lot until the time has arrived, and then they come into the emergency room and deliver the baby, and that provides them access. Those of us who are immigrants came to this country, and it took me basically a year of intense sort of paperwork to come to this country, and I'm very grateful for it. I came and became a citizen, and now as a U.S. citizen am involved in the political process, obviously. But yes, it's costing me money.
I think the number we're hearing is that there are approximately 47 million people who are either uninsured or underinsured. And I think that's blown way out of proportion, because of that 47 million people, we suspect that there's over 15 million illegal immigrants in the country, and that 15 million is included in that 47 million number. So if we removed the 15 million illegals that we are providing medical services to, we reduced that 47 million all of a sudden by 20+%. Obviously, the illegal immigrants are draining our system, and we have 4 states that border Mexico, and it is imperative that we secure those borders. And we find an alternative way to treat the people that we've allowed in this country and we've turned the cheek to for so many years. I've been a firm believer that there needs to be a port of entry for INS to check on someone's status as whether or not they're here legally or not. And quite frankly, if they're not going to do it at the DMV, then we need to do it in the hospitals. If you come to this country and you're admitted to the emergency room, we need to verify that you're a citizen of this country and that you're contributing to our system. This idea that the United States is an uncaring country, we heard that from the First Lady. That's the biggest pile of you know what. Our country has taken care of the world for 300 years.
Thank you, Mr. Henry. Let's move on because there's a number of questions, unless anybody had a pressing comment. Dr. Bozer, maybe we'll start with you on this one. Mary Tolbert asked of the panel, under the current plan, this monstrosity sitting here before me, are unions and illegals exempt from the health care bill?
From what I understand, it's mandated.
I think, from what I understand, the illegals are covered under the bill, and unions are exempted. They can keep their current plan, which tells you a lot about the plan they're proposing.
Dr. Bill Black?
I think I can address that. I told you I read through the bill here and I got it. Section 202, this is the House bill, as I understand. Exchange eligible individuals, it says all individuals are eligible to obtain coverage through enrollment in an exchange participating health benefits plan covered through the health insurance exchange unless individuals are enrolled in another qualified health benefits plan or other acceptable coverage. So by all individuals, I would guess it doesn't exclude any group, and that's all there is to the eligibility. So I'm taken by that anybody who's here would be eligible.